Tired of being tired all the time, not getting answers from your doctor about your chronic symptoms either? Hey, I'm Dr. Josh Bletzinger, and in this video, I'll share why you'll want to look into functional medicine and why it's the clear treatment path for chronic conditions. Did you know that conventionally trained doctors don't learn how to address most of the root causes of chronic illness, like nutrient deficiencies and toxins and gut dysfunction and more complex hormonal imbalances? Feel free to type your thoughts below. I'd love to hear what you're thinking. And if you find this content helpful, let me know by liking this video and/or subscribing below. The conventional approach to treating illness is great when it comes to acute care. So dealing with things like setting a broken leg or performing a life-saving surgery or even dealing with an acute infection. But when an illness turns chronic, traditionally trained doctors aren't trained on how to balance all the factors that create chronic illnesses like diet and lifestyle, environmental and microbiome gut health, and hormonal imbalances. So when it comes to approaching chronic illness, we have to think differently. We have to understand that there are underlying causes and to take an approach to address those causes. And for each person, there can be a completely different set of causes. Conventionally trained doctors are also trained to match a symptom to a medication, which doesn't work for chronic illness. Medications may suppress the symptom, but they certainly do not address the root causes. That's why functional medicine is so effective at treating chronic illness. Not only does it work to find the root causes of your symptoms, but a properly developed functional medicine program really looks at all the factors in your life that could be creating chronic illness, from gut health to hormonal imbalances, diet, sleep, toxicity, and even more. That's why I've developed a 3-step functional medicine system that can be delivered in this new virtual healthcare world. The 3 core concepts look like this. Number 1, creating a paradigm shift, knowing something's broken. A paradigm shift is just defined as a fundamental change in approach or underlying assumption. In this case, we're shifting our thought process and approach to knowing there are specific causes to chronic illness. So in type 2 diabetes, for instance, it's understanding elevated blood sugars are a sign, they're a symptom of a deeper cause. In autoimmune disease, it's understanding there are causes and triggers to autoimmune surges. That leads to number 2, which is evaluation and testing. So finding what's broken. We get to find the causative factors. That's the fun part, all right? Turning possibilities into probabilities, really taking a deep dive into what could be creating or causing the chronic illness. And once we find those causative factors, number 3 is creating a customized blueprint, okay? Fixing what's broken. A personalized treatment strategy will help guide you off the chronic illness trail. And if everyone has different causative factors to treat, to their chronic ailments, what must their blueprint and treatment strategy be? Yeah, it must be different. That's personalized healthcare. That's functional medicine. And so while my goal is to rebalance the body so that chronic illnesses and symptoms can be a thing of the past, the true goal is to teach you how to create vibrant health for yourself instead of struggling with the symptoms and the pill for every ill strategy that presents its own set of challenges. So thanks for watching. And if you are interested in partnering with me or just wanting to learn more about, keeping symptoms of situations like type 2 diabetes and other chronic illnesses in check, click the link in the description below to schedule a free phone consultation with me. I'll see you next time.